Name of scheme: Beti Bachao, Beti Padhao. Scheme description: campaign with the objective of improvement in sex ratio through societal change. Beti Bachao, Beti Padhao. Kaun Pujan. State Haryana, district, state level. Every district implements this activity. Good practice: Kaun Pujan. Objective: to reverse sun-centric rituals and promote gender equality. Key stakeholders: district administration, Anganwadi workers, Anganwadi supervisors, CDPOs, parents, Panchayat members, community members. Activity duration 2 to 3 hours. Frequency of activity approximately 15 times a month. Target group: community member and parents of girls. Description of practice: the mother's side of the family puts together gifts for the newborn girl. On the day of the ceremony, the mother puts water in a matka and goes to a well or temple where ceremony is conducted. A ceremony is conducted. There is a procession and a lady's sangeet that accompanies her to celebrate the arrival of her daughter. Food and sweets are distributed at the end of the ceremony. In villages that have a low sex ratio at birth, the district administration encourages families to conduct this activity. Anganwadi workers help identify families within villages and encourage them to conduct this activity. Status of practice: pilot scaled up. This activity has been scaled up across the state. Initially, the activity was implemented in a few villages in which Red Cross was active. The local Red Cross office used to initially give families that conduct a Kaun Pujan for girls fundamental benefits. Factors behind success of practice: the role of the AWW is crucial in identifying families who can conduct the ceremony. Just in implementation, the community's mindset is challenging to change because this ritual is traditionally sun centric. In particular, the elderly folk in the villages are rigid in their views given the rooted nature of patriarchal norms. Often, even neighbors accept Kaun Pujan for girls. Awareness generation resources: mothers meetings, Balika Manch, Anganwadi worker visits, and Panchayat meetings. Quantitative outcome value: 100 to 150 Kaun Pujans have been conducted per year for the last 5 years in 21 districts. Quantitative outcomes value: the acceptance of daughters as family members who are no longer considered a burden has increased. The community is willing to celebrate their birth. Today, under the implementation of BBBP, this activity is being conducted without financial benefits. There are instances in which the district administration has been asked the financial benefits to conduct the ceremony. However, there is a change in the mindset of most people in the community regarding this event, which is why the scale of this activity has increased across the state. Existing documentation or implementation in other locations. This activity can be linked with plantation drives, household level. A village level program would help generate greater acceptance of girls and parents of daughters. Nanne Chin State Haryana District Panchkula objective to value baby girls by registering their footprints in local Anganwadi centers. Key stakeholders, Anganwadi workers, families with daughters, activity duration ongoing, frequency of activity whenever a baby girl is brought for her first immunization after 2 months of birth. Target group families with daughters. Description of practice baby girls are brought to local Anganwadi centers AWCs by their families on the encouragement of Anganwadi workers AWWS. Their footprints are outlined on a chart paper and are put up on the wall of the AWC with the mothers and baby girls' names. This activity indicates the self registration of baby girls at AWCs and is symbolic of their education and participation in the community. Most importantly, it recognizes their existence and role in society by encouraging their status of practice, factors behind success of practice, challenges in implementation. The linkage with the immunization of the girl child is the primary reason behind baby girls being brought to AWCs. AWWs need to ensure that mothers visit AWCs for immunization. When mothers visit AWCs with their babies or daughters for immunization, their physical presence on the AWC ensures that the footprints of the baby girl are taken, which is symbolic of this program. Awareness generation resources, quantitative outcomes. 1,128 baby girls' footprints have been registered at Anganwadi centers is across 200 villages. Qualitative outcome or value. This activity is successfully achieving a dual outcome through increasing the survival and value of girls. Firstly, community members realize the importance of immunization, and secondly, through Nanne Chin, mothers and baby girls are being recognized in villages. Existing documentation or implementation in other locations, future prospects, potential for impact. There has been a qualitative change in the community as a result of the activity, and put it up on the walls of AWCs to give further recognition of mothers of daughters. This is being scaled up in all AWCs across Panchakula district. Comprehensive note on Beti Bachao Beti Padhao, a transformative journey of Haryana, launched by the Honorable Prime Minister on January 22, 2015. From Panipat, Haryana, the best Beti Bachao Beti Padhao BBBP program is the Government of India's flagship initiative aimed at addressing gender imbalance, empowering girls, and driving societal transformation. The government of Haryana has played a pivotal role in successfully implementing this program, making remarkable strides in improving the status of girls across the state. Key achievements and milestones under BBBP in Haryana. Matrix impact on sex ratio at birth SRB. Target improve SRB by 2 points per year. Achievements SRB improved by 34 points from 871 pre BBBP to 915 2025. Matrix institutional deliveries. Targets sustain institutional deliveries at 95% or above. Achievements institutional deliveries increased from 35.7% in 2005 to 6 NFHS 3 to 94.9% NFHS 5. Matrix secondary education enrollment and dropout reduction. Targets increase enrollment and reduce dropout rates through skilling and secondary education. Achievements enrollment in secondary education rose from 3,85,624 in 2015 to 16 to 4,736 in 2023 to 24. Matrix hygienes and menstrual health. Targets raise awareness and improve access to menstrual hygiene. Achievements free distribution of sanitary napkins to girls in classes 6 to 12 and women from BPL families aged 10 to 45 years. Dissemination in of IEC material and the development of menstrual hygiene kits by WCD Haryana. Progress in sex ratio at birth. Haryana has made a significant program in improving its SRB, which rose from 871 girls per thousand boys in 2014 to 916 in 2023, with a peak of 923 in 2019. The SRB of November 2025 stands legal and enforcement actions to curb female and ensure compliance with the preconception and institutional deliveries and maternal health. Haryana has made significant strides in improving maternal health care. Institutional deliveries rose from 35.7% in 2005 to 6 to an impressive 94.9%. Early ANC's recognitions also saw substantial improvements, rising from 51.4% to 85.2%. Girls' education Haryana has worked diligently to reduce dropout rates and increase secondary education enrollment of girls. Hygiene and menstrual health. To promote menstrual hygiene, the state has implemented several initiatives. Distribution of sanitary napkins to girls in classes 6 to 12. Government schools and women from BPL families aged 10 to 45 years. The state has also created awareness on menstrual hygiene through the dissemination of IEC maternal and the development of menstrual hygiene kits, awareness and community engagements. Beti Bachao, Beti Padhao 2.0 strategy was developed by the department and innovative methods used for progress under the scheme and revamping all schemes under the BBBP 2.0 strategy. August 2024 has been instrumental in reshaping societal attitudes towards girls' rights. The program is also available on the News on Air app, ensuring wider reach. Over 2 lakh participants have engaged in community gatherings, spreading awareness about girls' rights and empowerment. International collaborations. The Women and Child Development Department, Haryana, has partnered with international organizations like the World Food Programme and the International Institute of Population Sciences, Mumbai. These collaborations bring global expertise, enhancing the impact of BBBP and helping integrate best practices into the state's initiatives. Final report of the research proposal has been submitted by IIPS Vidya Vahini, State Haryana, District Kalithal, Kaithal, Good Practice Vidya Vahini, objective to provide a safe and subsidized transportation service to female students. Key stockholders: District Administration, Deputy Commissioner's Office, Red Cross Society, GM Roadways, CRS Partner, Indraprastha College Principals Gas Limited. Activity duration being implemented since 6th September 2019. Frequency of activity all working days in the week. Target group female students enrolled at local colleges and universities. Description of practice: a subsidized monthly bus pass service catering to female students of targeted colleges and universities has been organized, which flies on predetermined routes. This project is currently being piloted with assistance from a CSR funding partner, Indraprastha Gas Limited. Status of practice: pilot scaled up. Pilot factors behind success of practice: crucial diagnosis by Red Cross and college administrations, alike pointed the imperative need for this project. Once the need was established, the response from overwhelming positive. Awareness generation resources. IEC through local awareness campaigns, quantitative outcome or value. 1,200 plus female students traveled safety to their respective institutions of higher status of practice. Pilot scaled up pilot factors behind success of practice. Crucial diagnosis by Red Cross and college administrations alike pointed the imperative need for this project. Once the need was established, the response from citizens was overwhelming positive. Challenges in implementation. The two main challenges are the lack of long term CSR funding and lack financial coverage under BBBP. Awareness generation resources. IEC through local awareness campaigns, quantitative outcome or value. Existing documentation or implementation in other locations or future prospects or potential for impact as suggested by findings obtained from a baseline and endline survey conducted with student councils groups, parents, principals, and the local population. A monthly bus pass model is both sustainable and feasible and should be continued. This project has potential to be scaled up to the state level, whether through a district wise targeted basis or even under the fold of the recently launched Chhatra Suraksha Yojana launched by the Honorable Chief Minister Haryana. Vidyavahini District Kaithal, Haryana. Objective to provide safe and subsidized transportation services to female students. Description: a subsidized monthly bus pass service catering to female students of targeted colleges and universities. Outcomes: 1,200 plus female students travel safely to their respective institutions of higher education daily, breaking traditional stereotypes and changing gender roles regarding access to education and mobility in public spaces. Note on Mahari Ladu radio campaign by Women and Child Development Department, Haryana. Background: the Mahari Lado radio program was formally launched on 16th August 2024 at Panipat as part of the department's continued efforts to promote women's empowerment and gender equality. The initiative aligns with the objectives of flagship schemes of the government, Beti Bachao, Beti Padhao BBBP. Lahari Lado radio campaign by Women and Child Development, Haryana. Lahari Lado radio program was formally launched on 16th August 2024 at Panipat. Efforts to promote women's empowerment and gender equality. Flagship scheme of the government, Beti Bachao, Beti Padhao BBBP. Objectives: improves of the Mahari Lado campaign are as follows: behavioral and social change towards gender equality and the empowerment of women, awareness on health, nutrition, education, and safety of women and children, information about welfare schemes, rights, and legal provisions relevant to women, financial independence and leadership among women at the community level, positive role models and share success stories of women achievers from Haryana. Details is being broadcast through multiple All India Radio AIR stations to ensure. In addition, the program is also available digitally through the News on Air mobile application, ensuring accessibility for listeners across platforms and geographic locations. Listeners can tune in by selecting Akashvani, Chandigarh, Hisar, Kurukshetra, or Rohtak under the live radio section of the app. Program design and content strategy. Each episode of Mahari Lado is structured around a 15-minute focused segment, balancing information and interactive content to maintain listener engagement. Program design short, focused episodes. The 15-minute duration ensures concise messaging, sustaining listener interest, and fitting seamlessly into existing broadcast. Uh, Actionable information, local language usage, diverse thematic coverage. Topics include women's health, child nutrition, education, safety, financial literacy, digital inclusion, and leadership, etc. Wide outreach broadcasting through multiple air stations ensures extensive coverage across all districts of Haryana, including remote areas. Digital accessibility, encouraging use of the News on Air app, enables continued access beyond traditional radio broadcast range. Engagement or outreach. As of around November 6th, 2025, 57 episodes had been aired. The program has engaged more than 2 lakhs listeners. Recorded session. The department has engaged a total of 17 individuals, including various experts ranging from policymakers to grassroots activists who have delivered sessions on diverse topics relevant to women. Famous sports personality Miss Manu Baker was also engaged for recording with the purpose of inspiring others women across Haryana. Expected outcomes: enhanced awareness among women and girls about government schemes, rights, and support mechanisms, improved community dialogue on gender equality and empowerment, greater visibility and reach of departmental initiatives at the grassroots level. Award. The campaign was awarded the gold category in the Scotch Group Awards Women and Child Development, Women Development, Gender uh, Responsive Education and Training in 2025. Way forward. Continued collaboration with All India Radio Broadcasting Support and Punjab University technical support for sustained broadcasting to increase the airing of Mahari Lado in prime time slots so as to enhance its reach and listener engagement. To create dedicated broadcasting infrastructure or spectrum within government premises for uninterrupted and institutionalized airing of Mahari Lado. Integration of feedback mechanism